I'd like to introduce myself. I am Julie Alley, one of the marketing coordinators. Here with me is Erin Ruggieri, another marketing coordinator, and of course, Denise, who will be presenting today.
So we do have a poll question specifically for medical radiography. So what team in medical radiography, or what team is medical radiography not a part of? I think we end there. So it looks like we have a few people that thought the trauma team, the operating room team, the code blue team, or the biopsy team. So just so it's a bit of a trick question because there is no biopsy team. So that's the team that we're not a part of. Otherwise, the medical radiography technologist would be sitting on all of those other teams. The next part would be the video, Julie. So I'm just going to skip over that.
No, I can play the video. I'm just going to change
the video.
Okay. Yeah, just give me another second.
Okay.
What I love about medical radiation is the variety. It is different every day, and that's what makes it so exciting. And we'll go from there, okay? All right. As a medical radiation technologist, we use general X-ray machines. We use a fluoroscopy unit, CT, and mammography. The most rewarding thing about this job is when patients tell you how much they appreciate what you've done. That's why I love my job.
Okay, so if we're going to do the medical radiography program at BCIT is a 2-year diploma program. You do a term of academics where we teach you the theory of the positioning and the anatomy, we teach you the physics and the equipment, and then the next term you go out to clinical and practice everything that we've taught you. The students practice on equipment at BCIT that they will be able to find at most clinical sites. And the integration of VR is completely unique to BCIT. It helps the students learn the orientation of the anatomy and how it relates to the type of positions that we try and put our patients into. Once our students graduate from our program, they are fully prepared to write the National Certification Exam, the CAMRT, which allows them to work across Canada. The reason I love this profession is because of the changing technology and the time that I am able to spend with patients one-on-one, communicating with them and getting to know them. This is a really rewarding profession.
We're back on track now, guys.
Thank you. Okay, so welcome everybody. So what is a medical radiologic technologist? So I'm going to just say MRT for short because that's much easier. So we use highly technical equipment that produces ionizing radiation, to create images of bones and organ systems. The images are then interpreted by a radiologist to provide a diagnosis and a recommendation for treatment if it's required. Over the last 10 to 15 years, technology has improved so drastically that the procedures are faster, decreasing the exam times and making it safer, so allowing us to produce high quality images using minimal radiation. A technologist must not only have technical skills, but they also should have soft skills or human skills, as well as empathy. So strong communication and people skills allow us to work closely with our patients and their care providers to ensure their safety and comfort during a procedure. We communicate with our patients all throughout the procedure so that they know what to expect and what is required of them. Answering questions and providing answers that are clear and easy to understand will reduce a patient's anxiety during a procedure. Our program uses a variety of educational delivery methods to introduce you to the technical skills and help you develop the human skills. For the most part, we are constantly on the go adjusting our equipment and our patients. We are taught how to adapt all of our procedures based on our patients' abilities, since no two patients are the same. Next slide, Julie. So students are trained in, there's many different aspects of radiography, just based on our equipment. So all of the equipment that we use produces ionizing radiation, but there's different types of equipment. So the most common is the general radiography equipment. This equipment produces two-dimensional images that are best used to image bone and body systems, and it's actually fairly fast. The images are static and represent a moment in time. Currently, all images are electronic and can be viewed on computer screens. Gone are the days of film and film screens. Computed radiography, or the CR, uses an imaging plate that actually has to be passed through a reader once it's exposed, and then it brings the image up on a screen. Even faster is the digital radiography, or DR, which allows us to expose a body part right away, and the image within seconds will pop up on the screen. So this all, again, makes us faster and more efficient in the X-ray room while working with our patients. CT, or computed tomography, so also uses X-ray tubes and detectors, but they're housed in what looks like a really big donut casing. This allows the patient who's laying on a table to move through the donut. The detectors spin around the patient, and it actually takes spiraling images of the patient's anatomy. So whether it's the abdomen or the chest or any of the extremities that we're looking at, these images will show up on the computer screen as a series of slices. And then using computer reformatting, they can actually produce 3D images that they can spin around in space. So I do have an example of that. It'll be coming up shortly. So CT allows us to look at soft tissues, organs, and bones from the three-dimensional perspective. The next would be fluoroscopy. So this is actually dynamic imaging. So where the two previous categories were static images, a moment in time, or a moment throughout time, fluoroscopy allows us to actually produce radiation for a longer period of time at very low doses to actually watch motion or see the function of an organ or a system. So this is like creating a video. This would be commonly used to watch a patient swallow, or allow a radiologist to advance a needle into a joint to put something called an X-ray dye or contrast into that joint to see the inside of it, and to see how it moves. And this way they know for sure that they're in the joint, and without damaging the bone or any of the soft tissue structures around it. We also can use fluoroscopy in the operating room. A surgeon can use it to realign the bones right in time, and they will also use it when they're placing plates and screws over the fracture site to stabilize everything so that it can heal. Interventional radiography actually uses a combination of either a fluoroscopy and a CT scanner. And these are highly specialized procedures which allow radiologists to place devices such as filters or coils or stents into the blood vessels, catheters into cysts or diseased organs. A lot of these procedures are there to help patients that maybe have a pathology. Instead of having to have a major surgical procedure, they can actually come into the interventional suite, and we can do procedures for them there. And so the recovery time is much quicker for them. Mobile radiography. So everything mentioned above, we can actually do using mobile equipment. So if our patients can't come to us, we can go to them. We have patients that are in intensive care units or in the operating room or in the emergency departments and the trauma rooms. So we can actually take our equipment and go to them. We can also do imaging in the morgue. So if they are uncertain of the cause of death, or they are investigating a death, we can actually take our equipment to that area and actually do imaging there so they can see inside the patient's body. The last one I have listed is mammography. So the mammography also uses ionizing radiation, but it uses only a specific energy portion of the beam. So the equipment is created to compress the breast tissue and then use just the lower range of the X-ray beam to show the fine detail within the breast. So this is a 3D reconstruction of facial bones. So this patient had a CT scan done of their facial bones, so the front part of their face. And this is really cool because it actually shows very clearly the fracture in the lower corner of the jaw. What's interesting here is that the fracture's not just there. That's the one that's the most obvious, but there's another one sort of in the middle of the bottom teeth, because usually when there's a fracture in the jawbone or the mandible, if the impact is on one side, the fracture will be there, but there's always another fracture someplace else. So this allows the radiologist to actually get a really good look at the whole structure so they can look for all fractures and all pathologies. This would also allow a plastic surgeon to plan their procedure on how they would go in and fix this, again, using plates and little tiny screws. So hands-on learning. So the program itself is an integrated program. It runs for 6 consecutive terms, so 24 months. For the first year, we alternate between academics and clinical. The academic terms are face-to-face and on campus. We combine theory and simulation in our positioning and patient care labs. The students use simulation to practice positioning on one another, and then actually use mannequins and phantoms for exposures to produce an image so that they can actually take a look at what their positioning resulted in. Students practice using equipment in the positioning and the science labs, the imaging sciences labs, to get a better understanding of the physics behind the X-ray production and how the equipment itself works. We use immersive VR in several courses, and again, back to the imaging sciences. So, we talk about the production of an X-ray beam, but you don't ever get to see it. It's not something that you can visualize. We have a unique, one-of-a-kind virtual reality experience for our students, and it's called Be the Beam. So you'd use headsets and controllers to move the X-ray equipment around and set everything up, and then do an exposure, and you can actually see what the radiation is and what it looks like and how it's produced within the X-ray tube itself. Other immersive VR software that we have provide our students to actually use an avatar and position the avatar and bring the equipment in and actually do exposures. You can then actually send the image through and get feedback on what your image resulted in. So you're actually getting feedback in the moment. We also have simulation software such as Shaderware, Scalytics, and Complete Anatomy, which are made available to students so that they can access it from home, so they can just get further practice, or they can actually use it to complete homework and assignments. In the anatomy and image analysis labs, we have physical bones available for students so that you can actually hold the bone in your hand. And these bones are plastic, so they're not real bones, but they're plastic bones. And there's an instructor in the lab with you so that you can, as you're progressing through your course material, you can actually see the bump on the bone and how it correlates to what the image is of the bone as well. During the second year, students are, actually I should go back and explain. Once you finish your first academic term, then we do have a clinical term, and then you go out to clinical, and we'll talk a little bit about that in a slide further along the line. And then you're back to BCIT for the third clinical, or for the third academic term. So during the second year, students are out in clinical for all 3 terms. The winter and fall terms are in the general radiography department, and in the summer term, you're actually in the CT department. The clinical terms for our students, they actually work with a clinical instructor who supports their hands-on experience in a really safe manner. All technologists in the hospital environment are certified through the CMRT, which is our national certifying body. During each clinical term, students are provided with academic time to complete applicable online courses. So just less than 50% of the program is spent in the clinical environment. So each of our clinical sites do have a clinical instructor, as I explained previously. They manage the students' placement. The CIs are certified technologists who are hospital employees. So they're very familiar with the site's equipment, the protocols there, and the expected program requirements themselves. So they, even though they're from the hospital, we work very closely with them to make sure that the students have a very good, safe, relevant experience. So as the students gain experience in the clinical setting, they move from a direct supervision situation to a more indirect supervision. So you would start with your technologist or your CI working side by side with you, very closely watching everything that you do. And as you gain experience and confidence and you demonstrate competency, they tend to stand further and further back so that you are working more on your own. Through the clinical time, students will be expected to experience all shifts that are certified technologists is expected to work in the hospital environment. So I do explain this again a little bit later on, but we are a 24/7 profession. And so students are expected to get a bit of a taste of all those shifts, including afternoons and midnights. Each clinical term includes protected academic time for students to complete online courses, and the average is half a day per course that you're taking. The last clinical term, you do one course, and then there's one term where you're actually taking 4 courses, but you do have 2 academic days. We have 16 to 18 clinical sites throughout the Lower Mainland and in the interior. We have 12 sites in the Lower Mainland and 6 in the interior, which includes 2 sites in the Kootenays. The number of seats at these sites is standard and do not change. Each student will experience a minimum of 2 different clinical experiences and 2 different clinical sites. If there is the possibility of having a 3rd site, and that would be for the CT rotation. So some fun facts about the profession. So as I mentioned before, we are a 24/7 profession. So majority of our clinical partners have emergency departments that are open 24 hours a day, every day of the week. So that if that is the case, then for the most part, there is a technologist on site in the X-ray department supporting the emergency department. In some of the smaller rural sites, the technologists may not be on site, they may be on call. So if a case comes in, they would receive a call and have to come in. So we do expect our students to have some experience in all of those shifts, so they are prepared when they actually graduate and start working those shifts. We do both diagnostic and interventional. And so, as I mentioned before, when I was explaining the equipment, if somebody breaks a bone, they come in and we take an X-ray of that part, and it's seen away and reported right away and reported by the radiologist, whereas the interventional procedures are more to support patients that may have pathologies that require some intervention, but in trying to keep them out of the OR. So again, to reduce their recovery time. Direct patient care. So we are closely involved with our patients. Most of our procedures tend to be quite short unless you are in fluoroscopy or in the interventional procedures. Because we do spend quite a bit of time with them, our communication skills have to be good, and we have to be very comfortable with that aspect of the profession. We work in both hospitals and private clinics, so it's not all hospital work. Those are the experiences that we do have our students go through. Some of our clinical partners do send the students out for a clinical rotation or a small clinic rotation. That just means that their hours are more restricted and the patients tend to be of lower acuity than what you might see in a hospital. Again, yeah, the other part of that would be that there for screening mammography, there is a mobile screening unit that actually travels around. So in that case, you're not in the hospital or the clinic, you would be traveling with the unit going to smaller rural sites or rural cities that may not have a screening, mammo screening facility. So we actually bring that to them. And then our last fact, so I have said this several times, but I feel that out of all the professions, this is pretty exciting that we are mobile. We can go to the OR, that we get to go to the trauma room and help support the trauma team. We go to the patient's wards, and that we can also do some of our procedures in the morgue as well. Julie, were you drawing on the screen? Because now there's a big red circle.
Nope, it wasn't me.
It wasn't you. Okay, just checking. That's okay.
I tried to get rid of it. Somebody annotated, and I'm disabled annotating now, and now I can't get rid of this scribble. I mean, crazy.
Okay, it's okay. So exciting. So what can our graduates become? So as technologists and as we in a hospital setting, as we gain experience and build seniority, there's many leadership positions that we can move into, both within the department, the imaging department, and outside of the imaging department. But within the imaging department itself, so we can move into positions where we're shift supervisors, and this would include managing workflow, other technologists within the image department itself on specific shifts. The next step up would generally be the department supervisor or manager, which means that you would be managing an entire department. And then site supervisors or managers would actually manage an entire multi-diagnostic department. So that would include nuclear medicine and sonography. Yeah, those two. So stepping outside of the imaging department, within the health authorities, there's imaging directors. So they would actually manage multiple hospitals or sites, more so than just specific departments themselves. Within the hospital, but kind of outside of the imaging, we've had graduates go into informatics, and these technologists were quite interested in data analysis and educating and training systems for the end users. If you're interested in teaching, there's opportunities to become a clinical instructor within the hospital or to become an instructor at BCIT. So I started as a clinical instructor at one of the local hospitals in the Lower Mainland, and then made my way to BCIT as a clinical coordinator, and now I'm the program head. There's also product specialists for specific vendors. So if you're interested in the equipment and you enjoy selling, you can work with any of the vendors that we have. Our program here has Siemens and Philips, but you could possibly work for them, selling their equipment and doing applications for them. So it's pretty exciting, lots of travel and lots of networking there. So because we are a nationally certified program, our graduates can work anywhere across Canada. Once certified technologists have access to the American Register Radiologic Technologists, so the ARRT, so you can access their certification exam. So if you're interested in working in the USA, you can do that. You have to write the exam within 3 years of completing our program. And then there's also laddering opportunities into the sonography program and the MRI program as well, if you'd like to be dual certified. So I think that's it for the program specific information. And now we're going to move on into the admission side of things. And so this is about the entrance requirements. So our diploma program has one intake a year, and our intake starts in January. The department will select applicants once the deadline date is closed. This year we've had a couple of application windows. And so after each window, we've gone through the applicants and then sent out provisional acceptance letters. And there are still seats available for the 2023 intake. The qualities to be successful in this program or profession, as I mentioned before, so strong communication skills and an ability to work independently or in a team, excellent physical and mental health and time and stress management skills are a major requirement, strong decision making and problem solving skills, computer literacy, 3D visualization, manual dexterity, and hand-eye coordination skills. So application steps. So we're just going to kind of walk through the process of filling out the online application, but it is quite straightforward. Once application window opens for each cycle, you just log in and you can review the online an online application. You can work on filling out the application at your own pace. It does not go to admissions until you pay the application fee. The date you apply does not have impact on your application. You have until the application deadline date to actually submit your application. Regarding the application process, you will firstly review all entrance requirements and the application processing dates. So the dates are really important. You don't want to miss out because you didn't pay attention to that. You will then upgrade if necessary. So there's many opportunities at BCIT to upgrade course, or if you're actually missing a requirement, to take that as well. Ensure that when you apply online that you have all of your required documents, such as the transcripts, ready to scan and uploaded as PDFs. And there is a guide that will actually walk you through the application process steps. So once you're ready to apply online, you can visit www.bcit.ca apply. Application fee for domestic students is $90. The application process takes place entirely online, so you can't, mail in or drop off any of your transcripts. Everything has to be scanned in as a PDF and uploaded with your application. Okay, program requirements. One of the requirements is to be proficient in speaking and listening. So as I mentioned before, communication is very important when we're speaking with our patients and speaking with other our peers and with other professionals or professions within the healthcare system. English 12, pre-calculus 12, and physics 12, all 73% or the equivalent of those. Casper testing. So for Casper testing, you should register early because there's only specific dates that are provided, and once they're filled, they're filled. So the test will utilize everyday scenarios. A moral dilemma is presented to the test taker, and there is no right or wrong answers. So you can't really study for the test, and it's not something that you can memorize, or it's not a knowledge-based test. However, there are a full 12 section Casper sample test available online. You need to have been registered, go in and register for Casper, create an account to access the sample test. The test is free of charge, so you're not being paid, you're not having to pay for that. There is a lot of information on the Casper website regarding the process and regarding the purpose of this requirement. So please spend some time reviewing this information before you actually access the test. There is also a mandatory applicant questionnaire, which is specific to the program. So this is your opportunity to highlight any non-academic experiences you have that will strengthen your application, as well to highlight any of your skills and abilities. So as mentioned, as part of the online application, you will need to upload documents for a timely assessment to be completed. You can download official digital transcripts, or you can convert your transcripts and documents into PDF files. Information on how to convert files to PDF is available on the website. For example, you can scan or take pictures of your official transcripts and save them as PDF files and then upload them with your application. So please ensure that you upload all required documents to minimize delays in application processing. So for the admission process, admissions, once you've applied, admissions reviews the applications to ensure that all the requirements have been met. And once they've ensured that, then they forward the completed applications to our department, to myself and to our program admin coordinator. We then review all of that, all of the applicants, and then send out, and then we send that list back to admissions, and they would send out an admission, an acceptance letter with other the next steps and further deadline dates. And then to solidify your seat in the program, then you would have to pay the commitment fee. And I believe the commitment fee is $500. So laddering opportunities once you've graduated from the program. So there's quite a few opportunities at BCIT, but also some at other post-secondary institutions. You can, once you've graduated from our program, you can actually apply to get a second discipline, which is the MRI imaging. And there's two pathways here. One is to apply to just the certificate so that you just come out with the MRI certificate. It's the same procedure, except that it's 6 online courses and 1 clinical course. So you can do this all as you're working. And once you've actually completed all the requirements for the certificate, you would write another certification exam with the CMRT. The certificate is also part of the Bachelor of Health Sciences. So if you choose to, I think it's 6 or 7 more courses, all online. Once you've gotten your certificate, that you can actually come out with a Bachelor of Health Sciences. So you can come out with a degree. There's also a Bachelor of Health Sciences offered through TRU. The requirements are different. So you would actually have to go to the website to actually see what their transfer credit numbers are, because they're different than ours. We also offer the Health Leadership Advanced Certificate. So anybody that is interested in any supervisory position, or even becoming an imaging director out in healthcare, we do offer the Healthcare Leadership Advanced Certificate. We have had many of our graduates come through this program as well. And then BCIT also has a Bachelor of Technology in the Technology Management.
Yes, it is. Hi, everyone. I'm back. I'm back. Now, moving from the academics, I would like to let you know that BCIT is committed to supporting students in a holistic sense. We want you to succeed not only in your academics, but also outside of school. Some of the student services that are available to you as a prospective student, and others will become available once you become an enrolled student. Here are some of the student supports that I'd like to mention. If you are Indigenous, BCIT's Indigenous Initiatives Department is there for you to ensure a smooth transition into your first year. They offer peer-to-peer mentorship, a welcoming gathering place, and provide clarification on Indigenous funding. BCIT's awards, scholarships, and bursaries are listed on our financial aid and awards webpage. I would like to mention that we have a President's Entrance Award. Selection is based on academic achievement and also volunteer and community service. Please contact financial aid directly for more information. BCIT is committed to providing assistance to students with permanent or temporary disabilities. If you have been accepted to a program and believe you may need accommodation to be successful, I encourage you to connect with our Accessibility Services Department. BCIT Student Health Services is a health clinic located at the Burnaby campus. They provide medical care for students year-round. We also have a counseling and student development department and a recreation services department with a fully functioning gym, a quiet climbing wall, a racquetball court, and an open gym for team sports and intramurals. If you have any questions about the application process or need help getting the application in, please contact Program Advising. You can phone them, you can set up a Zoom or in-person meeting, and their email is available. Everyone will receive a copy of this slide deck and a link to the video recording, so you don't have to worry about writing any of this down. You will get it in your email. And of course, we're on social media. We're on Facebook, Twitter, Instagram, YouTube, and LinkedIn. Those are all the handles there. And if you wanted to learn more about our tours, spend a day, big infos coming up, more info sessions or advising, these are the links. At this point now, I'd like to open it up to the Q&A portion. I did receive a direct message from one person. Let me just read that one out. We'll start there because that was right at the start. There we go. Just wondering, after the program, registry exams would take how long? How many parts would it sum up? Thank you.
So the registry exam is only offered 3 times a year. So our program, again, is 2 continuous years, and it would complete in December. The certification exam right after is January. The exam itself is 1 4-hour online. Well, actually, they have test centers, but it is online exam. So it's just one exam, 4 hours, 185 questions, multiple choice. We tend to use that format throughout the program so that we're actually preparing you for writing the certification exam. And then there is the online course that you take in your last clinical term is all about preparing you for it. So we do a lot of prep work. And then usually you would get your results within 4 to 6 weeks. I hope that answers the question.
Thanks, Denise. We have, how in demand is the job and what is the average salary coming out of the program?
So entry to practice wage, there's different scale levels, again, depending on what shift you're working. But if you're coming out working as a casual technologist on a day shift, it's approximately $30 an hour. If you're doing midnights, it's a little bit more. Plus there's a little, there used to be like a meal allowance as well. Shift supervisors make more. So as you gain experience and seniority and you are in those higher leadership positions, then the wage goes up from there.
Thanks, Denise. How does the workload in the program compare to a full-time coursework for a Bachelor's of Science?
Okay. I came to the program many, many years ago, and I did graduate from BCIT. It's been over 30 years. And I came with a BSc from kinesiology, in kinesiology. And so the fact that I had a lot of anatomy and physiology coming into the program, I felt really helped me. But the course load here is, I'm going to say higher, and the volume is higher, but a lot of the courses are interrelated. So, we teach you, there's an equipment course, but you also practice the equipment and positioning. There's the anatomy course, but it aligns with the positioning course, the theory, and then the positioning lab course. So there's 3 courses right there, but they, all tend to focus on the same thing. But I'm going to say that the workload is higher and more concentrated. So we try and prepare our students for that. We're constantly talking to them about staying on track, not getting behind, coming to the instructor if you're struggling. We have lots of resources at BCIT to support peer tutoring, to support, and the peer tutors tend to support how you're studying, provide you with skills to study more efficiently and effectively. So there are a lot of supports, and the instructors within the program are wonderful. They're all certified technologists. They all have lots of years of experience, both out in the clinical environment and in teaching. So we tend to be very supportive of our students.
Thanks, Denise. If someone has a BA from a Canadian university, do they need to provide their grade 12 grades?
I think that's more of a program advising question. I think if your post-secondary courses are, are a part of, or I don't know how to put this, so this is why this is better for program
Can I
advising.
hear you there?
There we go.
Did you want me to jump in, Denise? I'm
Yes,
here.
please.
I've
Yes,
answered
please.
about like 40 questions already in the chat. I don't know if you guys noticed. So yeah, all good. I can definitely respond to that. No worries. Yes. So essentially you do have to prove how you meet the entrance requirements, which are all at the high school level. So sometimes post-secondary, for example, post-secondary first year physics course can be utilized to meet a physics 12 requirement. But normally we would ask that you submit your high school and your post-secondary transcripts. So when you self-declare essentially during the online application process as to how you're meeting each of the high school level requirements, you can either refer admissions to look at your high school transcript or your post-secondary, or a combination of both. But again, if it's post-secondary, you have to show that it's essentially an equivalent course to, physics 12, pre-calc 12, etc. So if you've done those courses in high school and have earned really good grades, I would say just, self-declare and utilize those high school level courses. And then you will also submit your post-secondary to show that you've done additional post-secondary, which of course will, add to your competitiveness as an applicant. So I definitely recommend submitting both when you're applying to the program.
Thank you, Maggie.
Thank you, Maggie.
And thank you for answering all those questions in the chat.
No problem. I wasn't sure if you guys knew I was here. So hi, I'm Maggie, program advising everyone.
To everyone, I don't think I introduced you at the start. This
That's
is
fine.
Maggie,
No
one of
problem.
our program advisors. We totally appreciate having you on here. We have some more questions. I'm trying to get through the ones that you weren't able to answer, and I've received some direct questions as well. For example, how are the volunteer hour requirements more flexible due to COVID restrictions?
Yes, they are. They were during COVID, and they're probably not as flexible as they were during that time. We're still asking applicants to provide us with any volunteer that they have done. A lot of the hospitals and senior centers and those type of places are now opening up again and bringing volunteers back in. So, we're flexible at looking at what you're submitting to us. We're also flexible regarding timelines. So, I've had some students actually complete within the first term of the program because they couldn't get everything done beforehand because it took them so long to actually get a placement. So we're being flexible about the type and the timelines on that. There was also another part of, I think it was Jason's question that asked about the wage, the starting wage. He also asked about jobs. There are so many jobs. The job opportunities right now are wide open. And in talking to our clinical partners and the health authorities, they feel that there's going to be plenty of jobs projecting forward over the next few years. So lots of work.
Our next question is, my wife and I are expecting our first baby in May. Is there much wiggle room in the first part of the program for taking, say, a week off?
In the first part, so if you're referring to the first term, it's an academic term. We have had students actually being pulled on from a wait list into the program 2 weeks into the program, so it is doable. It is tight though, but again, that is such a happy experience that we wouldn't want to take that away from you. So there's always conversations that can happen, and the instructors again are more than willing to help support staying on track and getting caught up.
Thanks, Denise. Our next question is, Is medical terminology for imaging MedRad 0150 course a requirement for this program? And when can I take this course, before this program, during, or after?
So for that course, it's part of the provisional acceptance. So once the program has reviewed the applicants, sent the list to admissions, they send out what's called a provisional acceptance letter. And on that letter, that would be one of, your provisions that you actually have to complete the medical terminology course and receive an 80% on it. So you wouldn't have to worry about actually taking that course until you're actually provisionally accepted into the program. It takes about 8 to 10 hours to do. And it just makes sure that everybody that comes into the program starts at a minimal level of medical terminology, because we start talking appropriate language for medical terms right away.
We're going to have to bring it down to our last couple of questions. We're running out of time. So many good ones. In the profession, is there a lot of opportunity to work with neurosystems, spinal cord, brain, etc., or is the work more focused on other body systems? If someone got the MRI certification after, would that open more neuro-related jobs?
So we do. Right now at VGH itself is the spinal cord, spinal trauma center. So they do have a building that's dedicated to spinal cord injuries, not just injuries, but even pain management and that and diagnoses and stuff. So we do have a lot of ability to work with those type of patients, especially once you've graduated, and if that's where you choose to go work. And we do, in trauma situations, that's always a big concern. And so we talk about it and we teach how to move patients with spinal cord precautions, et cetera, in the program as part of our patient care management courses. And sorry, was there another part of that question there, Julie?
No, I think that was it.
Okay.
Maggie's answered most of the questions here. Just scrolling through to see if there's anything else that hasn't been answered. No, I think we've gotten to everything. I hope so. Anyhow, if you have more questions, you reach out to Denise, medical radiography, medical_radiography at BCIT.ca, or else reach out to advising. There's the emails. You're going to get emailed the slide deck and a link to this recording. I apologize for our technical mishaps at the start. Thank you to Maggie for all the great information you provided. Thanks, Denise, for that excellent presentation.
Thank you. Thanks, Julie, for doing what you do.
And I'd like to thank everybody for taking their time out this evening and spending the last hour with us. We appreciate you learning more about the program, and we hope to stay in touch. Thank you all.
Thank you so much.
Thank you, everybody.